Good afternoon. I'm Janice Canallen, and I'm on behalf of the Children's Health Coverage Coalition, which includes Children's Defense Fund of California, California Coverage and Health Initiatives, PICO, United Ways of California, the Children's Partnership, and Children Now. Our coalition has been working for the past 16 years on coverage for California's children, and now MediCal serves half of all California children. Getting children covered is important, but it's essential that we also ensure that once children are covered, they actually are able to access MediCal doctors, dentists, and providers. California currently ranks 49th in per-child Medicaid spending. In a survey of California pediatricians, 89% indicated that lower rates make healthcare providers less inclined to see MediCal patients. If provider supply is limited, children often suffer because they have difficulty seeing high-quality, culturally competent providers willing to see them and serve them with their needs. Thank you.
Thank you.
Good afternoon, chairs and members. I'm Anna Hasselblad from California Coverage and Health Initiatives. I echo the comments of my colleague from CDF and TCP earlier this afternoon. I have 6 family stories that highlight the need to specifically address children's access issues. Those 6 stories came into me since 2 p.m. yesterday afternoon. In the interest of time, I will summarize them. They include 8-hour round-trip transportation on public transportation for specialty pediatric services for a child under 10 years old, areas with no local transportation services for a family with a 3, 9, and 17-year-old needing services currently, to being assigned to a primary care provider a county away, to appointments being 2 to 3 months out for for child-specific medical attention. I commend the members who addressed children-specific issues in MediCal and encourage continued attention to these low-income families. Thank you.
Thank you.
Mr. Chair and members, Fred Main on behalf of CalPACE, the program for the all-inclusive care for the elderly. We support the rate restoration of AB 97 for the overall health of the access to the MediCal program, but also the rates of the PACE programs are set basically on a fee-for-service equivalent, so the rate reduction affects us. We are very appreciative that a small bump was made in the rates for PACE programs effective April 1st, but we still are subject to the AB 97 cuts as well. Thank you.
Thank you.
Jennifer Snyder on behalf of the Osteopathic Physicians and Surgeons in California and also the National Coalition of Assistive Rehab Technology. The osteopathic physicians obviously are family physicians. They are specialty physicians, and in both cases, both clients very appreciative of what this committee is doing and your efforts moving forward to try to restore the rates for physicians. And specific to the Coalition for Assistive Rehab Technology, these are your custom wheelchair providers, custom rehab technology. They put together and provide the chair of one of the speakers that you heard earlier, and also for disabled children, most at-risk, most sick children in the California Children's Services Program. They have been impacted by the 10% rate prospective. They're also going to be subject to a retroactive cut, which will amount to about a 5% additional cut for a number, for 2 years. In both cases, if you think about a custom wheelchair, it can be from $6,000 to $30,000. It has an extensive amount of labor that's associated with assembling the chair. There's also service and repair that's related to that. Specifically with the CCS program, it continues to be fee for service. So the rates that are now under this particular situation with these cuts are highly impactful to the CCS population in particular. With these folks, there's probably only 2 providers that provide about 2/3 of services to this, the MediCal population, and they're dramatically impacted by these cuts. So again, we do appreciate your efforts and want to wholeheartedly support getting rid of both the retrospective cuts and also prospective. Thank you.
Thank you.
Good afternoon. Matt Robinson, California Association of Health Facilities. Thank you very much for your time and for this hearing. Some of our membership, we represent over 500 intermediate care facilities for developmentally disabled, the habilitative, and nursing. These members are 100% MediCal funded. Because of this 100% MediCal funded, we weren't cut the full 10%, but more along the lines of about an average of 2 to 3%. But we're still subject to that rate freeze. It's because of this current rate system and freeze for these members. It's very problematic for these providers to stay afloat while still providing the necessary services for the residents. Thank you.
Hello, Chairs Bonta and Hernandez and members of the committee. Before I say what I wanted to tell you, want to introduce myself. My name is Rick Hodgkins. If you've heard me speak in hearings before, you know that my stage title is Disability Rights Advocate, Disability Rights Activist, and Disability Rights Extremist. I am a member of Capital People First, which is an organization run by and for people with developmental disabilities. And I'm also a member of the Supported Life Institute's Peer Advocacy Connection Committee, or PAC Committee. And I am also a member of the Department of Developmental Services Consumer Advisory Committee, serving Alpine, Colusa, El Dorado, Nevada, Placer, Sacramento, Sierra, Sutter, Yolo, and Yuba counties. And what I wanted to say is, now that we expanded MediCal, we need a rate increase to equal to that of Medicare. And, I was on managed care for a while, but I am off managed care. I'm back on straight MediCal, and I just find out that I get much better care under straight MediCal than I do managed care. I see some specialists at UC San Francisco, and one of those, which is not here in Sacramento, that's what we call a neuroendocrinologist, something that we can't have here in Sacramento. But I will say this, that it's about time that we have a rate increase, because what's the point of expanding MediCal if you're going to keep the rates just where they're at? Thank you.
Thank you.
Hi, my name is David Thompson. I'm going to talk not a few minutes, about dental surgery centers and the people they treat. There's 19 dental surgery centers in the state of California here. They treated over 30,000 patients last year. Most of these patients are children or developmentally delayed. The children are primarily there because the amount of decay in their mouths is so extreme that they can't get it all done in one visit. The reason they're there is because they don't have access to preventive care. If they had access to preventive care, 30,000 patients is a lot. That's a lot of savings if you can keep them out of our surgery centers. I'm not trying to shut the surgery centers down. I'm just saying it's a more expensive measure of treatment, and if they had preventive care, they wouldn't be there. That said, even the surgery centers cannot cover their costs with the rates they're currently being paid. The facility fee doesn't cover the cost of the facility. The anesthesia fee, you will never find an anesthesiologist willing to take a Medi-Cal rate at its face value. They are always subsidized by somebody else. That subsidy comes either through grant writing or fundraising, a lot of everything other people mentioned as well. One other point I want to make about managed care, we need to be very careful with access to care and managed care. They have an authorization process that very
need to
easily...
ask you to please wrap.
Okay, very easily thwarts access to care. There's a health plan that has denied over 1,000 patients access to care since October, and there's no resolve. We filed the complaint in December, and it's still unresolved. Thank you.
Thank you.
Good afternoon, chairs and members. I'm Cynthia Van Zandt, and I'm here with Sacramento County Child Welfare Systems. And I represent the foster youth, which is our most vulnerable population. And because there has been a problem with access to care, we've not been able to get our youth in to meet some of our mandates. First of all, we try to have our youth, when they come into care, to be seen within the first 30 days to have a dental and medical exam. That has been very problematic and not being able to meet those standards. We also have a number of youth who have specialized medical treatment, and plans have changed without being notified, and when trying to find other providers, they will not accept a particular plan for that child. So that breaks the continuity of care for those individuals. And then there are other medical providers we have that have long-term standing history with our children and no longer see them, which, as was stated earlier, it results in ER visits, which can be very costly. And the last I would like to mention is the hospital dentistry problem. It has been problematic. We have fewer hours in the hospitals because we don't have and there are few dentists that will be able to provide those services. And our youth may be in pain and have severe issues that may have to wait 2, 3, 4 months, and they are having pain. So it's very problematic, and many of our kids are without the regional class, CCS clients, which means that they have some issues where they cannot sit in the chair long enough to maintain while the dentist perform the treatment.
I need to ask you to please wrap.
Yes. And then the anesthesia is just the other problem. But just the main thing is that the shortage of medical and dental providers has been causing a problem with access of care for our foster youth. Thank you.
Thank you.
My name is Eric Fimbers. I'm a principal with R3S Group. I'm also a member of the Managed Care Dental Advisory Committee based here in Sacramento. And I wanted to use this time to continue the conversation about authorization processing for managed care. I think there's a great deal of confusion that's going on between the medical side and the dental side, and that is what's causing barriers to access to really important dental care for some of our children. And the reason being is that when we try to connect with the medical side to get authorization for the medical portion of the anesthesia in inpatient care, we're immediately shut down because they immediately hear dental. And we ask that the Department of Health Services look into that very closely to get this confusion cleared up. Thank you.
Thank you.
My name is Albin Romberg. In a certain sense, I'll speak for some future Californians. You may be surprised, and I hope you're perhaps shocked, that there are some enormous increases that have been made. I read one sentence here. An increase in reimbursement rates will provide early and consistent access to services and significant cost avoidance. I think we've heard a great deal about that here, about poor children being denied essential dental care, many other medically indigent people who are not getting the care they need. This sentence, however, refers to the fact of a 40% increase of certain procedures. You're looking a little blankly at me. Perhaps I'll let you know what they are. Those are termination of pregnancy, and the cost avoidance they're referring to is the denial of life. In other words, killing the patient so you don't have to provide them with further care. If that's cost avoidance, I would say that's Orwellian. And you can smile and laugh, Dr. Hernandez and others, about this. However, this is a paper by the Department of Health Service. I'm holding it right in my hand. You have access to it. That's called cost avoidance. Now, I will question that. Finally, I will question that. It's now well established that the very high rates of abortions performed on young girls before they have their first term pregnancy causes premature birth, especially very premature birth. It's very costly. There was an exhibit in the corridor here by March of Dimes showing $1 billion a year cost. That is, it's well
Sir,
established.
I need to ask you to
one of the
please wrap.
causes, yes, one of the causes of that is abortion. California has so many. So cost avoidance, this is Orwellian. Many of these other people, why don't you give 40% increases to some of the services for these poor children? Help Dr. Wood take care of some of these dental patients with a 40% increase. And many of these other services for the truly medical indigent, instead of providing 40% increase to kill babies and cause their mothers to have premature births.
You're long over time, sir. Thank you for your comments.
Take action.
Okay, I want to thank the members. Dr. Wood, thank you for your participation today and all of your comments and input. Mr. Patterson, thank you. Mr. Chairman, it was a pleasure. I want to thank our staff and all of our colleagues who participated in today's what I believe was a very robust, very helpful dialogue. I want to thank our guests and panelists who are still here. Thank you. Thank you for your participation today, and of course all of our members of the audience and the public who participated. This is a really important issue for all of us, and I look forward to making collective progress this year. Thank you, Mr. Chair, did you want to say anything? Okay, thank you. We are adjourned.